And honestly, that as Stuart mentioned, I probably would not be here today if not for the TL1 grant that I received. I think it was 2013 or 14. I think it was between 2013 and 14. Maybe it was 2012. I can't remember. These years kind of blur. But ultimately, my pathway was I I went to undergraduate school, or I was an undergraduate at Truman State University in Northeast Missouri, which is a very small liberal arts school. I'm from St. Louis, Missouri originally. Then I went to Temple in Philadelphia for medical school. Then I decided I had enough of the East Coast and decided to return home to St. Louis for my internal medicine training. And that's when I really got the research bug. And that's when I also realized that you could be a physician and also pursue research. So my mentors at Washington University in St. Louis really took me under their wing. And that's when I saw that there was a pathway for integrating the two. Because up to that point in my time, up to that point in my career, I was always under the impression you either had to pursue science or you had to be a physician, but you couldn't do both. But my eyes were open at WashU. I came to Ohio State in 2009 to start my cardiology fellowship. And I knew that I wanted to stay in academics. And I knew that I wanted to integrate and incorporate research. At the time, my thought was, okay, it'll probably be clinical because that's what I was exposed to. And those who my mentors were up to that point. But then what I realized, because I was fortunate to have really good mentorship, and I think that's the key, and that will be a common theme for me at least, is having really good mentors and listening to them and listening and getting their advice when you need it most. And they realized that the research questions that I had and I proposed were more translational and basic in nature. And they thought that would be a better fit for me. And I thought, okay, great. I don't know anything about translational or basic research. So how am I going to pull that off during a clinical fellowship? And ultimately, one of my mentors, Phil Binkley, Dr. Binkley also teaches and has a critical role in the CCTS. He introduced me to Peter Moeller and said, you need to talk with Peter and move in that direction. So I said, okay, great. So I was told that Peter Moeller was a translational guy, and turns out he was very basic. And I thought, there's no way this is going to work. Why am I meeting with a basic scientist? I don't know anything about holding a pipette or dealing with animal models. This is not going to work. But Peter was very engaging. He believed in me, and he helped me see a pathway forward where I could do this. But what I realized is that I needed more time. I realized I actually enjoy working in the basic lab, and I enjoy learning that science and answering those questions and testing hypotheses. But I needed time. So I allocated some of my time during my third year of training, about 6 months, to research, but that wasn't enough to really immerse myself in a basic science project. So Peter and I decided that we should apply for the TL1 at that time. So we wrote a grant, and actually I think Dr. Binkley helped with that and served as a co-mentor in that process. And fortunately, I received that funding, and that was a critical turning point for me in my career pathway, because I was then able to take time out of my clinical training. And it ended up being almost a year and a half where I didn't do any clinical work. I would have to maybe sneak off maybe once every week or so just to go see a few patients in a clinic, just to, because I mentioned I didn't want to lose my skills. But yeah, I was totally immersed in the lab at that point, full time. But the other great thing is, in terms of why I have this joint appointment, was with the TL1, I had the option of pursuing my master's in public health with the focus on translational research. So that was a great experience. It was challenging to go back to school after having been out of school for over a decade and becoming a student again, and having 10 to 15 years on my classmates in a pre-COVID era when you still went to class. But it was a great foundation for me to understand methodology and truly what it meant to translate work. So that was a great background for me. So after finishing up my research time with Peter and finishing up my MPH, I then did a transplant fellowship and joined the faculty in 2014. And by having this unique background, I was able to then carve out a career that works for me. I've been able to mentor a few epidemiology students and master students on some of their work because of my joint appointment. I've been on some candidacy committees for the college and things of that nature. So I've been able to still be involved, not as much recently because some of my mentors are no longer at Ohio State that I work really closely with. So which is why I'm maybe not as involved as I have been previously, but the opportunity is still there with the right mentors. So, and then having that time, as I mentioned, when I joined the faculty allowed me to develop my own research program. The life lesson for me is that in graduate school, you're at this stage where you're still able to figure out your ultimate trajectory. And I think you have to just think about what truly interests you, what direction you want to go. The possibilities are really limitless. And also really having a very strong mentorship team. Sometimes you can't see the direction you want to go, and your mentors can point that out to you in terms of what pathway to pursue and what career trajectory you want. So, and that's what really works for me. The transition can be challenging at times as you transition from a graduate degree or from a fellowship, so to speak, to faculty. But I think that's when you have to rely on your mentors and the foundation that you've built and trusting that process that you're going to be okay, you can do it. There may be a few bumps along the way, but there are also resources, whether it's resources here at Ohio State to help you along or with your mentorship team as well. And that team you start to crystallize and form that team now, and that will follow you throughout your career as you transition from a graduate student to eventually faculty or whatever pathway you decide to pursue. Those can ultimately become lifelong mentorship teams and whatnot. So I guess in a nutshell, that's my journey of how I started out solely focused on clinical medicine and then made a 180 to really pursue basic and translational research to now this, I went from working in a small little bay in Peter's lab and having an office with no window in a corner of the 6th floor that was very small to now having a very robust lab that I love working with 3 graduate students, a postdoc, research scientists, and technicians. And it's just been a phenomenal process to see that anything is possible. So I just think the key is not to limit yourself. And there are a lot of non-traditional pathways that you can pursue to reach your final destination. So I think I'm an example of someone who took a non-traditional pathway to become a physician scientist. So with that, I'll stop because I can ramble for another half hour if I wanted to, and we'll turn it over to Dr. Norris Turner.
Thanks for that. I have quite a different story from Dr. Smith, except in the respect that I think it's also fits in this non-conventional path. So it's nice to have 2 narratives and recognize yourself in parts of one or parts of the other, or neither or both. And I think what we both probably would emphasize is that there is no one way to do it. So quick bit of background, I'm an infectious diseases epidemiologist. So the last couple of years have been really, among the most exciting in my life from a scientific perspective. I did my graduate training at the University of North Carolina in Chapel Hill. And I came to OSU also in 2009. So I didn't realize we'd been here in Columbus the same amount of time. I came as an assistant professor in the Division of Infectious Diseases here in the College of Medicine, which is the the position I still hold. Although just recently I was promoted to full professor, and normally I don't make a big thing about saying that, but I do think it's important to just say it here. There are about 500 faculty in the Department of Internal Medicine. There are only 10 full professors who are women who have tenure. And so insofar as it's nice to see people who are kind of, still perceive themselves to be middle-aged and in mid-career, kind of getting to the top of that academic heap, I think it's a good model or a good thing to visualize. So here I am, that was just this spring. So So when I was in graduate school at UNC, there was a very close connection between the Division of Infectious Diseases at UNC and the Division of Epidemiology in the School of Public Health there. It was really a hand in glove circumstance. And many students who finished in Epi kind of got jobs over across the street at the hospital doing ID Epi as PhD scientists, some of them on faculty, some of them as staff scientists. So when I saw this job at Ohio State, that was in the Division of Infectious Diseases, but for an infectious diseases epidemiologist, a PhD scientist, I thought, I know this path. This is something that makes sense to me. And I was finishing graduate school at the same time as my husband, who's a philosopher. And so we had this two-body problem looking for placements, academic jobs. And so I did not carefully scrutinize what was happening at Ohio State. It was just a place where we could both end up and both be in faculty jobs in the same city. And so it came. And I quickly learned that, in fact, there are very few PhD scientists in clinical departments at Ohio State and the College of Medicine, in particularly in clinical divisions, which ID is one. And so I got here thinking, I know this path, I know a lot of people who have done this. And then I got here and there was nobody who did what I did. But it really forced a period of kind of extreme creativity, which was very stressful at the time, but has bore so many benefits, and those things still reverberate today. So I study, before COVID, I studied sexually transmitted diseases and HIV. And after about 6 months at OSU, I realized there were no chlamydia and gonorrhea people. There was no one studying syphilis. And the people who studied HIV were doing clinical trials, but there weren't really prevention scientists. And this forced me to collaborate with the health department really extensively. And that then has turned into a decade-long collaboration with the sexual health program that's part of Columbus Public Health. And most of my federal funding has gone through clinical studies that I have designed through Columbus Public Health. And that, as I say, that partnership has just been fantastic and continues now with COVID. I also had a few lucky things happen where, even though I didn't have tons of people working in my content area at Ohio State, I encountered wonderful mentors in various places. And some of them were in the college and in my division, but more of them were actually certainly outside the division. Rebecca Jackson, who runs the CCTS, is one of them, but even outside my own college. And so in the College of Public Health, I found, of course, a lot of other PhD epidemiologists, and those people became very close collaborators and continue to be now. So the graduate students I supervise, and I have been the dissertation advisor on multiple doctoral dissertations at this point, are all College of Public Health students. And that's really possible at OSU. I hope it's possible everywhere, but it's really possible here to be cross college and be supported. A couple of other things that I'll just emphasize. I mentioned that my spouse is also an academic, and I think sometimes when people are going on the job market with a partner who also has kind of challenging job placement circumstances, they don't really want to talk about it, or they worry about how to navigate that. So if people have questions about that, I'm happy to share more about that experience. And the other thing is that I'm a parent, and being a parent is a really important part of my life. The day that I found out I got tenure, I was sitting in my office writing a grant, and I got the email that said your vote was positive. And then the next email I got was from a parent of a friend of one of my children's friends saying, let's form a Girl Scout troop. And normally that's the kind of thing pre-tenure that I would have said, I can't do any of that. And then I thought, no, this is like what I'm doing as a parent. I'm going to form a Girl Scout troop. So if people want to talk about any of the integration of family with professional life, I'm really happy to talk about that here or at some future time if people have questions about how that navigation worked for me. And I think I'll stop there. I'm happy to chat more about any of these things, but don't want to use up too much of our time if we want to have a more robust conversation.
Yes, what questions do you have? Deliberately put this panel together that would have a PhD and an MD, so you could get some different perspectives there professionally.
Yeah, I have a question. And I guess this is more towards our PhD guest. Did you know that you always wanted to be a PI of a lab and running your own lab, or did you consider other pathways before you got there?
Yeah, great question. So I am definitely one of those people susceptible to recency bias. And this is what I mean to say, which is that before I went to graduate school, I absolutely fantastic experience working at a nonprofit with a mentor who was so wonderful that I actually named my first child after her, just like a person who changed my life. And, I just was definitely going to leave graduate school and go and work for that same nonprofit, for that same boss for all time, and didn't have any aspirations that I needed to be the one to write the grants. And then a bunch of things changed over the course of graduate school. And then it was time to go on the job market. Like, you get all those cues, like now's the time you submit your applications. And so I thought, well, I don't know what I'll do. So I'll, and again, because of my spousal situation, I just kind of threw out a bunch of applications. And then it was a very kind of positive experience where I got interviews, and then I got job offers. And then I thought, like, oh, I guess if these people think I can do it, maybe I can do it, So I came, and I think, again, because of my family situation, I was always with this idea that I'm going to be open to a lot of places and options. So the type of place that I would work, the sort of prestige, quote unquote, whatever that means, the location, geography, size, city, all those things. There were a few things I was unwilling to compromise on, but they more had to do with like time zones and being close to an airport. A lot of my research is done in an international setting, and I didn't want to be in a place where I had to drive 3 hours to get to the airport to be able to get an international flight, but like not the normal things that people, I think, use to make those decisions. Looking back, I wish that I had thought a little bit harder about whether I wanted to be a PI, because I feel lucky. I love being a PI. I love the work of being a PI, and I love supervising a research group. I don't think it works out that way for everyone. And especially in public health, there's a huge cohort of people who get a master's degree, love applied work, love interviewing and working on projects. They're good at it. So they go and get a PhD, and then they realize actually what they wanted to do was the master's level work. That's what they found gratifying, right? So they've spent 5 years doing this hard work, and then in the end, they don't like that job as much. And that could have happened to me. I didn't really interrogate that as closely as I could have. So I'm happy with where I am, but I also feel lucky that I got here without being as considered as I might have been.
Since you are both, running research projects, can you say a little bit about what training maybe you probably didn't get a lot of training on how to manage teams of people, or maybe you did, but what, if there's something you would like suggest people should do during graduate school or be thinking about that would help them to be, managing, Sakima, you're what, 3 graduate students, postdoc, research scientists, and technical staff. You've got a big team there.
Yeah, I think that's a great question. I know there are some, the FAME program here at Ohio State, I know they, in the past, they've had programs in terms of how to be a PI and how to build your research lab and things like that. But I think some of it comes with experience, some of it comes by having great mentorship, and some of it just, I think you have to look at it 2 different ways. You don't need an MBA, but you need to know how to run a budget, right? So you need to at least know some basic operational aspects in terms of finances, overheads, direct, indirect costs, things like that. That's critically important. That you don't learn, you learn it over time, but again, that's where having a great mentor is critically important. So that was something that was a novel concept to me in terms of having to understand that. So I would spend time, I would pull out a sheet and I was like, Peter, walk me through this. What does this mean? I don't get this. I don't understand what these indirects mean, what these directs mean. How do I navigate this? I started to work with Peter's research scientists with budgeting. Like, how does this work? I want to make sure that I actually have money aside and plan for projects. So a lot of that came with just one-on-one mentoring and asking questions to develop that aspect. And then the next step was actually knowing how to deal with people, which is also critically important. So thankfully, I'm decent with that. Just I think because I have to deal with patients and people every day as a physician. So it's critically important for me to make sure that I was bringing in the right personalities to the lab, because my mentors' labs and other lab environments I saw what worked, and I also saw what didn't work, and how when you have conflicting views or maybe toxic personalities, it can derail the entire productivity of the lab and make it not so great or sometimes even hostile. So I learned some lessons in that regard and tried to make sure that I was bringing in good people. Obviously, you want people with skills and talent and all that, but you can teach most of these people are smart, and you can teach them things they need to learn. But you can't teach them how to be good people or good humans. Oftentimes they come with that. So you have to make sure you vet that up front, because that, as you create that environment, that will then attract like-minded individuals. And now you have a very productive environment where people actually get along and don't mind doing things. So then you can grow that. So it started very small, bring in the right people, right work ethic, right work ethic and right personalities. And then slowly, as funding will come about, then you can bring in more people, again, bring them in, vet their personalities, the mix. And it just worked out for me. I love my lab. It's a very diverse lab. Of my 3 graduate students, 2 are women. One is African-American male. My research scientist is a woman. And I just think it makes for a very inclusive environment, which is really important for me. So everyone feels welcomed. Everyone feels like they have a voice. So everyone makes great contributions. And so I think that environment just lifts everyone up, and allows us to continue to build a successful laboratory environment, in my opinion.
Yeah, I agree with all of that. And I'll just add another piece of it, which is, we talk a lot about team science, that everyone makes their contribution on the science side, and that those things are all valued across the team. But it's true on the operational side too. So you might be a person who kind of gets stressed about budgets. You're not good at them. You don't like to open the emails that come every month and tell you how much money you have. It causes you stress. You need to get good enough that you're willing to open them and look at them and see if there's a big problem. But you also can build a team where you have someone that you work with who likes budgets and is good at budgets, and you pull them in. And it's the same way, like, you might be a starter of 1 million projects and leave a lot of things hanging. But if you partner with a finisher, then you can get a lot of work done, whether that's grants or papers. I work very closely with a group of people where like a different colleague of mine is sort of the vision person. She's the one that gives the, kind of big talks to get everybody excited about the project. But I'm the one that keeps the trains running on time. I'm the one that tracks all the regulatory stuff and make sure we turn in our progress report and our IRBs and kind of writes the SOPs, because that's like the place where I can really contribute. But together, she's not that good at that, but I don't want to give a speech at the start of the workday either. So if you can find a partner who can even you out, you can be like highly productive. I will say, in this particular example, the person that I work most closely in this setting happens to be my sibling, who is also on faculty here at Ohio State and also was a KL2 scholar a couple of years after me. And we do enough work together that there's a few people on campus who think that we are like just one highly productive person who does all of the things. So it's actually, kind of has led to some funny misidentification and kind of confusion over time. So maybe you're not lucky enough to have your own sibling and dear friend be your partner, but those people exist kind of across the academic landscape. So
I had a question. Sorry.
Go ahead, Eric.
Oh, okay. Hi, my name is Eric. Sorry, no camera today. Hey, I had a question for Dr. Smith. I found your pursuit of translational science particularly compelling. Obviously, you're a doctor as well, but have you had difficulty navigating the academic space as a translational scientist? For example, obtaining grant funding might be difficult without a clear clinical or basic science focus.
So thanks for that question, Eric. And I think that's a really important question. So ultimately, most of my grants are actually written at the basic science level in terms of mechanistic in nature, is how I approach it. And typically my strategy is to have the first 2 aim somewhat mechanistic, and then the third be somewhat translational in terms of where I want to go with this. There's not really a space at the NIH well, I guess there's a translational group, but for the most part, you try to integrate it within your science, or as you get the grant, you try to find a way to translate that later. But I don't think I don't write true, like, quote unquote translational grants, because sometimes it's hard to find that space. Oftentimes they're looking at the two extremes, the very basic or the very clinical, and that in between space is challenging. So what I try to do to navigate that, because it can be difficult is to write a grant that is very mechanistic in the first few aims, and then try to write a compelling way of how this is going to impact patients in the third aim, and how we can get there, and what tools and methodology we will incorporate. So I think it is challenging at times to be a translational researcher. I think ultimately I have a foot in both worlds more often, in terms of on the basic and the clinical, because I still do some clinical and outcomes-based work. So it's just something that you have to learn and navigate. Sometimes you will be fortunate, and there'll be different special grant opportunities that will come up through different funding agencies that specifically want a true translational project, or they want to, or there's some foundational grants will want a physician and a basic science PhD and this and that. So then to really enhance collaboration and translation. So there are some of those opportunities that come about from time to time. But I think traditionally it's a harder fit, and a lot of grants are looking at the two ends of the spectrum. You just got to find a way how to navigate and where to integrate yourself in that space. So that's what I try to do. And that works for me, at least.
Perfect. Thanks so much.
Mhm.
So I bring up this question. I think this is hopefully a good environment to ask this. And since Dr. Turner, I think, has a similar scenario to myself, in the sense that I have the two-body problem. The guy I'm dating is also a postdoc, and we're trying to navigate this space where we're at the stage of our life where we're thinking about having a family. And I guess in my postdoc studies, I get kind of obsessed with my research. I'm working long hours. I'm trying to meet deadline to deadline. So it's a relatively stressful environment, and, all the time being spent in lab. And so, maybe there's enough females in this group to kind of bring up that, environment of trying to start a family when we're so wrapped up, both of us focused on research.
Yeah, I'm happy to share what my experience was. And I guess the overarching theme is there's no one way to do it, right? So, but I guess a few of the things that happened for me was on the two-body problem in particular. When you apply for jobs, I have learned that the places that are posting jobs expect people to have partners, because academics tend to partner with academics. So they're not surprised when you get further down the path, that I need to figure out what's going to happen for my partner, who is also an academic. So don't feel like you can't share that. Now, I wouldn't share it, on the day that you do your first interview, but if something is looking promising and productive, yes. And this recommendation for the Academics podcast, one of the people who runs that is somebody I went to graduate school with, Whitney Robinson, who was fantastic. And now that I'm on the hiring side for some of these things, I know that our committee discusses, like, if this person is somebody that is promising, we talk about it in an optimistic way. Let's be proactive. Let's make sure that we can make space for this partner who may or may not be coming along, right? Let's figure out if there's a way to make our space feel comfortable and welcoming to this person who we'd like to hire. That's not going to be true at every institution. There were definitely places which were interested in me, and then when they found out there was a partner, they were like, see ya, we can hire who we want. We're not going to worry about this. But I think that's less and less the case now. At least I hope so. The other thing about that, though, is that institutions are slow as crap, right? So you can't tell them that when they offer you the job, oh, can you please find a place for my partner, and expect that it's going to work out on a rapid timeline, like if you're managing other offers. That seems obvious, but unless they happen to know the chair of the other department, and they can move things really quickly through a system, it's definitely going to take some weeks to work that out, even when it's happening quickly. So when you're excited about the place, give them a little bit of time to figure that out, and give them a chance to make it work for you. And then the last thing I'll say about the two-body problem is, don't agree to any job where the person says, we're going to work something out for your partner, but let's get you here first, and then we'll put them, we'll sort of figure out where they're going to fit, because the most leverage that you have is before you say yes to the job. And I know, unfortunately, a lot of people who have ended up with kind of stranded partners with these kind of promises that I think were sincerely offered, but there's just no motivation to make it happen once you're there, or much less motivation to make it happen. On kids, my kids were born when I was in graduate school. So the trade-off there is I had no money, but time-ish, I was only slowing myself down. I have colleagues who had kids when they were postdocs or junior faculty, and each of those things has benefits and trade-offs. It's all hard on the timing consideration that you just raised. Like, little kids take a lot of time, but they're also, at least in my experience, was like a deeply satisfying part of my life, and forced me to stop working sometimes, which I just needed, right? Like, I needed a reason to not be working all the time. As I mentioned, because my partner's also an academic, there we did a lot of trading off. So there's some negotiation that happens there. You have to have a partner who's willing to do that. It's much easier to be in a place where you have other support. I'm not saying anything sort of shocking. I think that the only people that I feel have really struggled is people who knew that they wanted a family and were just waiting for the right time. Those are the folks that I think, looking back, they maybe wish they had embraced the time when they wanted to have the kid, as opposed to the time when it felt right with their academic trajectory. Because it doesn't always work out when you decide the time is right for you. There may be some years before it can actually happen, and that, I think some of those folks have some regrets later.
Thank you. I really appreciate that advice.
I have a kind of related question. Maybe if either of you could just speak more to kind of the work-life balance and any strategies that have been helpful for you, especially considering kind of the different demands of graduate school versus postdoctoral or other kinds of fellowships, and then early faculty careers. Anything that has been helpful.
I'll just give you my perspective, because I wear a lot of different hats, which makes my life stressful in general. So, I have the research program, then I have my clinical work. I'm vice chair for diversity, equity, and inclusion within the Department of Internal Medicine. I have a similar role for the Heart and Vascular Center. I'm also an associate program director for a cardiovascular medicine fellowship program. So my days can be quite hectic, but what I've learned is that for me, I have to be very efficient with my days and plan almost every hour of each day of each week and what I'm going to do to utilize that time. Because what I realized, especially, I have a 2-year-old daughter, is I'm not going to take time away from her to accomplish these academic needs. So I need to be efficient with the time. And what you realize is that when you really are very focused and myopic on your schedule, you can get it done. You just may not have a lot of time to goof off, but you can still be productive. I'm a morning person. So what works for me is to get up super early, and most of my days start at 6 a.m. That's what works for me, because that's what my mind is thinking on my non-clinical days. And I try to end my day between 4 to 5. So I do my 10 hours or 11 hours differently. So some of my colleagues come in at 8 and leave at 6, whatever. That's what works for me. But that also works for me because then it allocates time in the evening so I can actually spend time with my family. I've also realized that I need to be super efficient during the week and work week. Is because if I'm not on call on the weekend, I don't want to do work on the weekend. I want to spend that time with my daughter. So in the past, I would often do Saturday morning, I would do some work, or Sunday morning, if it's grant season, maybe when everyone's asleep, I'll try to sneak in a little bit of work. So I don't feel guilty about it. But for the most part, I try to be very strict with my schedule. I say, and I've learned to say no a lot better. When I first started as a faculty member, I said yes to everything. And I quickly realized I was getting me into trouble. So I'm very good at saying no. I have no problem. And I will say yes only if it fits into my schedule or for something that I'm passionate about, which is why I'm here today. Because I'm passionate about this. This program meant the world to me. So I've often been involved in different activities. But I say no to, for every one thing I say yes to, I say no to 10 things, just because of all the different things I get asked to do, because my time is precious and I don't want to, I know that I'm not going to dump extra things that aren't finished to the weekend. My days need to end at a certain time so I can either work out and then go home or whatever. So it's about being very disciplined and very structured and very focused and maximizing every single hour of the day so I don't have to do stuff on the weekend, and absolutely learn how to say no. And it's okay to do so, because that will start taking away, you can't do it all. And the more you say yes to things that you don't really need to say yes to, that aren't going to advance your career, that aren't going to help you make the connections for research, you got to be very strategic what you say yes to. If it's coming from the dean or a chair, or, I mean, that's a no-brainer, but you don't need to say yes to every single committee and things like that, because they can just distract you. And then it impacts your balance. So for me, I'm very, very disciplined about my time because I refuse to take time away from my daughter.
Yeah, maybe I'll just add a couple of quick things to that. So the first one is, you don't have to figure out one strategy now that's going to work for all time. So there have been times where I worked in the middle of the night. There have been times where I worked early in the morning. Now I get up early in the morning so I can exercise, because that's important to me for my own balance. And then I, kind of work on more normal hours. But there have been times where whatever strategy I picked worked until it didn't work anymore. And then I figured something else out. So that's true about parenting. That's true about everything, right? Like, it's good until it's not good anymore. And then you have to switch to something else. On the issue about saying no, I like 1,000 million times agree. Especially at the early career stage, it's exactly as Dr. Smith just said, you have to be choosy about which things to say yes to, and you won't always know. So having mentors that you can run those things by, ideally the mentor isn't the one that asked you to do the thing, which puts them and you in a kind of a conflict. But they can interpret, like, that thing sounds good, but it's actually not that useful, versus this sounds like nothing burger, but if you put it on your CV, it's a sign of your growing reputation. And I found those things quite hard to interpret in a college of medicine, where I had kind of grown up in a college of public health and really needed somebody to help interpret those things. Also, once you clear that mid-career hurdle, you will have more opportunities to participate in things than you can ever imagine, right? So if there's something that feels kind of right up your alley, but you don't quite have time for it at the assistant level or the postdoc level, it's okay to let it pass. It'll come back around when you're an associate or later. I would only say yes to the things you must say yes to, or that are your deep passion about your work, about your advocacy, whatever the thing is. If you can't imagine saying no because of how much you care about it, we'll definitely say yes. That's what gives us all life in this space, right? To get to be involved with the things we really love. But anything that's less than that, you'll get another swing at that. So that's a little way to kind of triage some of those requests.
Awesome. Thanks so much to both of you.
Kind of related to that, can you talk about what some of the challenges and stresses were coming from, assistant professor to becoming tenured? Was that a particularly stressful kind of period, challenging one?
It's challenging because everything has been focused on this promotion milestone, and then you're over it. And then you kind of think like, oh, what am I supposed to do now? And the world around you sort of knows that's coming. And so that summer after I was promoted, it wasn't just that friend who asked me to form a Girl Scout troop. It was like, will you start teaching this class? Will you take over this committee? Will you, and I thought like even my professionals, everyone's kind of ready. This idea that you've just cleared this really stressful thing. And so I think it's a place where mentorship really continues to matter, is that you need somebody to help you figure out which of those things you're going to pursue and how to have a bit of a directed path. You no longer have everyone breathing down your throat to make sure that your productivity meets all those earlier metrics. No one's going to tune into how you're doing for a couple of years. You do get a breather, but it's a little bit. I found it the time to be a little bit. I was more groundless before I figured out kind of what I wanted that middle chapter to look like.
Are there challenges in finding a mentor when you move from one institution to another?
I think there can inherently be some, just because you're not familiar with the institution, but inevitably, it come, there's a large academic network. So sometimes before you even arrive, you can start to, you're with your current local mentors, they can mention, hey, when you get to institution XYZ, make sure you touch base with so-and-so because, or whatnot. And but sometimes it's a matter of once you arrive, getting a feel, a lay of the land, and these things happen organically, right? So it's just getting a sense of who is working in the same space that you're working in, and similar interests, and word of mouth, and asking around. For me, I mean, I did medical school residency and fellowship at 3 different institutions, and I still have mentors at each place back to this day. And oftentimes, before I made the move, someone would say, well, when you get to, WashU, reach out to so-and-so. When you get to Ohio State, these are some people that you may want to reach out to. And then, when you reach out, it may work or it may not, but then they may also suggest you should reach out to so-and-so. So then it eventually develops organically as you spend the time at that respective institution, and figure out who's working in similar spaces, or who could be a great collaborator. The one thing that I learned from Peter Moeller is that you can't learn it all. So you need to learn what you know and what you don't know, and figure out who are those individuals that can complement your research and your skill set to build up your program, and reach out to them and have meetings, get a sense of someone you want to work with scientifically or whatnot, and just start building up that network over time. I don't know, maybe Dr. Turner has some other thoughts.
Yeah, I was just going to say, I've changed institutions very, very little. So it's a little bit of a twist on that question. My experience has actually been no one ever goes away, especially if you work in a small research field. So I still collaborate and write advance with somebody that I met before I went to graduate school. In fact, before I had the job, before I went to graduate school. She was a graduate student who worked for a professor that I did some research assistant work with a long, long time ago. And she stayed in the field, and so did I. And so the people you meet along the way don't ever stop being your mentors unless you decide to stop having them be your mentors. It doesn't matter if they're not your institution anymore. You'll need to find somebody locally who can help you, navigate whatever is your local situation. But in a good way, no one ever goes away. And also in a bad way, if you really flame out with someone, they're going to still come to the professional meetings. They're going to still know the same networks of colleagues that you have. So it's a kind of reminder to be to kind of try to steer the middle ground with people who are controversial or challenging in your field as much as possible. I mean, not to be a bystander to a sort of toxic or really terrible environment, but to recognize that however much you might find somebody unpleasant, they're still going to be around in the future, and you got to kind of figure that out.
Kim, I think you had a question.
Hi, thanks for all of your transparency and discussion today. It's been really helpful. I am preparing to defend my dissertation in the spring and transition to a faculty position soon after that. And I have a young family, and this transition is going to involve a move. And so all of these topics have been really relevant to my situation. I'm sort of curious, in addition to finding good mentors and collaborators, if you have any advice for kind of high yield places to focus your time in those first couple of years to get research going, and not investing too much time in things that maybe might not be most productive.
I would print out the guidelines for what you need to do to get promoted and post them someplace in your office and check them regularly. Because a lot of times we sort of know productivity, but it's actually kind of helpful. If the guideline is 15 first authored papers, if you know you have 7 at the end of 2 years, then you're just kind of marching on, right? So really keep eyes on the prize in the most sort of applied, practical way. The other thing is when you're on the job market, really ask the faculty, ask the chair of the department, ask whoever's hiring you in the search committee, how do they protect junior faculty? What's the philosophy? I mean, do they have a plan where they hire you because they expect to tenure you? And here's your reduced teaching load or your startup package, or, the thing about grant support budgets, like how do they make your time focus totally on the science and take care of the other things around you? And if you have the option, choose positions that do a better job sort of supporting that. In terms of specific places to spend your time, I think it's so field specific that I wouldn't want to give you direct advice, but I imagine somebody that you're working with would have sort of very clear guidance, like don't join this kind of national committee because they write all the guidelines and it's, whatever the thing is, right? They can steer you toward low amounts of time, but high yield service, for example, so that you don't waste your time getting bogged down in something really tedious that takes too much time. I guess, I don't know if Dr. Smith has more to offer about that, but I'll just add the other thing, which is very good advice I got. No one really expects much of you in the first year. So if to get yourself and your family and your house and your lab and your office and your car and all the things, if that takes you a year to get that under your feet, just give yourself a year to get that under your feet. The expectations for that first year, even though they might tell you that the expectations are high, generally people don't get very much done in that first year. So anything you do manage to accomplish in the first year, consider a bonus, and really imagine the first day of your second year is when you have to hit the ground running on productivity.
I agree. And I think the concept of understanding very early the requirements for promotion are critically important. I think I thought about too often, too late, and some of the timelines of when you can actually go up and when you need to work on your dossier and when you need to have that together, your statement, et cetera. So I think it's never too early to start thinking about that and looking at some of those really clear, definable metrics that are readily apparent, and you can easily pull it up and say, this is what you need to get to, from assistant to associate to professor. And also know that I agree 100% that your least productive year of your career is going to be that first year and or two, as you're kind of getting situated, but then maximize that time to your advantage to establish your family, your location, all these essential things that you're going to need so you can thrive later, building up your network and mentorship teams and things of that nature. So by year 2 or 3, you're ready to hit the ground running and really be super productive. You've done all that upfront, because it takes time, right, to have meetings. Who's going to be a good mentor? And you may think someone could be a good collaborator, maybe they're not, and getting a sense of the lay of the land and things that it takes time. So if you invest that time wisely, I think you get the return on that investment in years 2 and 3, where you can really be super productive. You have everything organized, you have everything squared away with family, with work, with mentorship teams and collaborators, and you can just really, and you have a target of where you need to go with the different metrics that are required for promotion. I think that's a great strategy.
That's exceptionally helpful. Thank you.
Other questions? I know you must have them.
I was just going to add one thing to the prior question, which is, I think what I just described, get it all organized, and what Dr. Smith emphasized, get it all organized in the first year so that you can pick up in the second year. Like, you can do all of that, and bad stuff can happen, right? We've just lived through 18 months where a lot of unanticipated things happen, many of them personal, a lot of them impacting productivity. And I think in many of the spaces where I'm operating, what I've seen is the introduction of a lot more flexibility into all these processes, which in my opinion, should have been there from the beginning. That people, graduate students, postdocs, faculty, we all live complicated lives where unanticipated things are going to slow you down. The people who struggle the most in those circumstances are the ones who feel like they can't share that information, either because they have a toxic boss, which hopefully no one here is living in that space, or they just have this imposter syndrome, lack of confidence. They're worried if they tell someone it will be held against them for a long time. Those not getting help or not letting people know when you're struggling because things happen, in the end, it can really hurt you. So I would also, when you're ending up in a new place, try to find someone who is maybe not your boss, maybe a little bit outside your space, who you can check in with if ever things feel like they're going off the path, so that you can figure out, what am I going to do about this? Who am I going to let know? How am I going to rewrite this? And definitely not wait till it's like the 5th year and then you're telling people, well, you know, in my third year that I was here, I had really severe depression and I didn't submit any grants for a whole year. Like, let them know what's going on. And I've been kind of warmed to see people's responsiveness to recognizing that we all struggle at times.
I would kind of like to hear some more about how you went about setting new goals once you did get tenure.
Dr. Smith, do you want to answer that first?
So how to go about setting new goals upon tenure? That's a great question. Ask me next year, hopefully when I finish that process.
Okay, so I'll give you my quick, what happened to me. You know, the year before I was going up, I wrote a ton of grants. I didn't have very much funding, and that was like my main weakness going into my tenure decision, but I got tenure. And then, you know, you revise and resubmit, and some stuff takes a long time to get through. And I was due for sabbatical. So I like pursued how I was going to go on sabbatical. And my sabbatical was basically like write a bunch of grants. That was my sabbatical project. And then in between May and July, when I left the country for my sabbatical, like 4 grants got funded. So I had all of these plans for my sabbatical. Like, I'm going to sleep all the time. I'm going to travel, visit my family. I'm going to think deeply about all, you know, all these things in the field and figure out my next step. Then like all this work that I had been hoping that I was going to be able to do before, it all kind of came into place. So whereas I had imagined really changing gears for the middle stage scientifically, in the end, I was able to just do this work that I had been setting up for the whole time as an assistant professor, but not actually able to execute. So now 5 years after that, as now that bunch of grants got me to be full professor. And now I'm thinking about how I'm going to figure out scientifically what's next for me, but also the things that I feel really passionate about kind of in the academic space that are not strictly science. So I do a lot of mentorship. I do a lot of sort of faculty development type stuff, some things related to promotion and tenure, that whole process, like the sort of academic affairs space of the university has turned out to be a place that I find really gratifying. So figuring out how to pivot some of the now privilege that I have in the position of having a protected position, how am I gonna turn that energy that I have for that into something else? We should do a session, Stuart, about sabbatical at some future time. That's something that not a lot of people in the College of Medicine take, and they should.
Yeah. Well, we are about at the top of the hour, so I want to thank our speakers very much for coming to speak to us and demonstrating that they consider talking to this group a priority in their busy schedules. So very privileged to have you here and give you, and I hope everyone appreciated your frank advice and encouragement. And so thank you, everyone. Next month, we're going to have John Chrisman to talk about grant writing. Hopefully he'll tell you some of his wonderful stories about how he failed at grant writing. He's now a very successful writer and well-funded researcher, but he's had some doozy of mistakes early in his career, which you can all learn from. So look forward to that next month. So again, thanks everyone.
Nice to talk to you all. Thanks.
Thanks, Stuart. Thanks.